this isn't my smell, then that's a sign that you might want to replace your estrogen. But you don't want to use soap or a douche or any feminine washes or anything like that. Just your soap and water. Your vagina is self-cleaning. It's a self-cleaning oven, and that's all you really need. But when we talk about taking care of your vaginal tissues, definitely there are some over-the-counter, also non-hormonal moisturizers that you can get. You can use coconut oil. If you do, just be careful if you're using latex condoms, because you might look on the package. But there, you can use sunflower oil, coconut oil, olive oil. If you want to go for like a product, there are some really clean brands out there. And then, like I said, there are some that contain estrogen. I don't know of any besides mine that are over the counter, but there's ones you can get prescriptions from your gynecologist or your primary care provider if they're open-minded enough. So there's so many ways about it. And just knowing that it's there and knowing that it's so normal, like every single woman who reaches the age of menopause will experience something in this category. Like I said, whether it's the painful sex, the loss of sensation, whether it's itching, burning, a sense of fullness, a sense of having to urinate more than you think you should, like you wake up and you have to go to the bathroom, but you don't really have anything to go. That is also a sign. So there's so many signs and symptoms that can be treated so easily.
I was thinking about this too. Like sometimes I get the question from patients for women that have sex with men, and they're like, well, I'm scared. Like I'm putting the stuff on me or in me. Like,
Mhm.
what's going to happen to him?
That's a really great question. And with topical hormone, systemic topical hormone replacement, depending on the preparation, so there are some that are designed to absorb very quickly within 10, 20 minutes. So usually those are absorbed within the skin. But if you're sweating and it's on like your arm, there's a chance of exposure. And like I said, for systemic hormone replacement, that level of estrogen is going to be like 100 times what you would need for vaginal estrogen. With vaginal estrogen, it's such a micro dose and it will absorb into your vagina fairly quickly. But even if your husband's exposed to that, he has more than that amount of estrogen in his body. Men need estrogen too. So men's primary hormone is testosterone, and ours is our primary like female hormone is estrogen. We have more testosterone than we have estrogen, but men also need estrogen. If a male has a lack of estrogen and he's trying to work out in the gym and improve his body, he's going to have a harder time gaining lean muscle if he doesn't have enough estrogen. So it's not that men are supposed to have zero estrogen, but the amount of transfer, it's the same as placebo. So they've done studies where they will test blood levels in women, in the women who are using it, and in also their partners. So for the women who are using the vaginal estrogen, they'll test their blood levels and they don't have any increase, like versus placebo, it's the same thing. The first couple of days that you use a vaginal estrogen, you might have a slight increase in your blood levels, like a minuscule increase, because if your tissues are really damaged, there could be some seep through. It's not going to be anything that's going to be really remarkable. But after that first couple of days, there's going to be like the same as placebo. And then for the men too, you can test their blood levels and they have like nothing. They'll have maybe a little extra moisture as well. So
It
it's
seems
completely safe for the it's low dose vaginal estrogen is what is used.
I always think when from the cosmetic world, we're always talking about kind of catching things early to try to help cosmetically. But when we talk about the vagina, nobody says, like, okay, maybe we should start using this preventatively.
Yes, yes. You know what? It's almost like because I'm in this field, right? I know what I know.
Yeah.
And when I was in school, learning about the female anatomy and learning about the changes of perimenopause and menopause, I was like, what do I have to do to not have to deal with that? Right. So I am a real big fan of being proactive. I think like I talk to my patients and they're getting their daughters, making sure they have a routine for their vaginal health. I mean, it's definitely something that you do want to be proactive about for sure. And here's a funny little note that most people don't know. So the skincare industry, especially expensive beauty brands that you find at department stores that might charge you $100, $200 a jar, they use undisclosed amounts of hormones in their creams because they actually work. So things like a face cream or night cream, there's oftentimes when they take it to a lab and test it by a third party independent lab, they will find trace amounts of estrogen in that cream because the estrogen is really plumping. It's helpful for collagen and elastin. So it actually really does work on your skin. So kind of an off-label thing we do in our practice sometimes if women are using topical hormone replacement, we'll have them put just a little in their skincare, and it, it's like cheap cheap way to work wonders. So but that's, it's because it really works, and so they don't oftentimes disclose that. Like, you'll look on your label and you're like, there's no estrogen in my cream, but we'll do testing before we start hormone replacement therapy, and every so often we'd have a woman who, like, are you sure you're not using hormone replacement therapy? And then she'll tell me what brand of skincare she's using, and it's one that I know for sure does that. And so we know for sure that they do put it in there. But the reason why is because it's plumping, it's restorative, it's protective. When we hit menopause, like at age, like average age of menopause for most women is around 51, but it could be a lot earlier, it could be a lot later. The first 3 to 4 years of the period being absent, you can lose 30% of your collagen. I think it's even higher. It might be like 36%. So you're coming along and you're losing some collagen, all of a sudden, boom. And so this is why a lot of women will wake up in the morning and they'll be like, I feel like I look like 10 years older, like overnight. It's not really overnight, but you kind of notice that your skin's just not, it's kind of starts to be crepey. It's not as like, like kids, you poke their face and it pops right out. It's just not the same. And so that's happening our face that we're looking at all the time, but it's also happening between our legs too. And we're not doing a thing about it. We're doing a lot for our face because that's what we see all the time. But the longer we wait, the worse things get. And unlike a lot of the other kind of troublesome symptoms of menopause, the hot flashes, night sweats, brain fog, those for the majority of women will go away after a certain amount of time. The vaginal vulvar symptoms, they just get worse. And so if you don't do anything about them, if you do something about them, they get better. So it's not doom and gloom at all, but you really do have to do at least something, whether it be non-hormonal. But the estrogen, super low dose estrogen, I'm talking 10 to 20 micrograms of estradiol. And we use a little bit of estriol also because estriol is very hydrating and supportive for the estradiol. But man, it can make a huge difference. Huge difference.
Talking about some of the other products. So there's other products that are out there on the market that are used for like vaginal moisturizing.
Yeah.
I was going to ask you what kinds are out there, and do you think they work?
Yeah, so there's actually also, we didn't talk about vaginal DHEA is getting a lot of press lately, and it actually does work almost as well as the estrogen. Doesn't work as well for the UTIs and some of the symptoms, but for moisture, for elasticity, for atrophy, the vaginal DHEA can be really helpful as well. The difference is the vaginal DHEA you have to apply it daily, where the estrogen, you'll apply it daily for a couple of weeks, and then you can move to maintenance of like 3 to 5 times a week. You can continue to apply it daily if you're still having severe symptoms, but once you get to the point where you're noticing improvement, the vaginal estrogen can be spaced out, where the DHEA will be an everyday thing. And it's really a preference because some women I feel like some people still have a stigma against estrogen for whatever reason. So they might prefer the DHEA. With the DHEA, I think what edges it, the benefit is it does increase like sexual stimulation a little bit more. So if you have a sensitivity issue, if you're not getting orgasms because you just don't have that like arousal feeling, or you're just less sensitive down there, the vaginal DHEA can really be helpful in that area. So we like to offer both. So that's an option. And then non-hormonal options, those will really help with moisture. Those can help with plumping the skin. Though if you're not going to do anything, definitely do that. And I don't know if you want me to give you brand names, but you want to look for ingredients that you recognize. Some popular ingredients are going to be things like shea butter, hyaluronic acid, which you probably noticed from like your facial skincare. Some will have coconut oil, some will have sunflower oil. Cocoa butter is another good one. Beeswax is one that is used a lot. And there's some other ones that some people will say they have like exotic stuff in them, but sometimes they just have like different names for common things. And they'll say, oh, it's a, it's a peptide blend, but it's really just, coconut oil or something like that. But there are a lot that have chemicals, alcohol, and they can burn and they can sting and they can be very uncomfortable. So just be careful, like if you are doing it over the counter, what you're putting down there. And always, like just like any skincare, you always want to spot test it on like your arm, right? Put a little bit on your arm, make sure you don't have a reaction, wait a few days, do it again before you ever, try to venture into, because that would be very unfortunate if it burned. I just, someone just sent me an organic deodorant to try because I get a lot of products to try. And so underarm deodorant, and it's aluminum free. So I'm like, oh, that's great. It's great under my arms and it burns like hell. And it was alcohol. It was organic alcohol. And I had just shaved my arms under my arms. So you got to test things before you put them. So if that was a vaginal thing, I'd be crying all day long.
Oh my God. Yeah. I was thinking about, well, unfortunately, some of those products have propylene glycol in it, which I always tell people like, stay away from that. I'm
Yes.
surprised at how many products have that. And that could be a mucosal tissue
Yeah.
irritant. And it's
Yeah.
in so many women's products.
And you want to make sure whatever you're using is pH balanced. That's super important because there's a lot of things that will mess up our vaginal pH. Our sex will mess up our semen's very alkaline. So this is why we always say urinate after sex, rinse off after sex, because that will change your pH. Even foods that you eat, wearing nylon underwear, leaving sweaty gym clothes on and going to the grocery store, all that stuff can mess with your vaginal pH, but so can some of these moisturizers if they're not pH balanced for the vagina. And vaginal pH is 3.8 to about 4.5. It can be higher than 4.5 if you haven't had your period in a while, and it's still considered somewhat normal. But I would say you want it in that range. And so usually a product will say whether it's pH balanced or not. If it doesn't say it, it probably isn't, I'll say.
It's so easy, like for me, the menopausal patients, because I'm like, okay, like that seems like cut and dry. But there are some other conditions where people's estrogen are low and they start getting these vaginal symptoms.
Oh my God. So populations that you would not think. Breastfeeding moms, if you breastfeed for more than like close to a year or more, you're going to have a drop in your estrogen. You're going to get a lot of vaginal dryness. It will go away. So as soon as you stop breastfeeding and things you'll go back to normal. So it's not the same situation where it's never going to get better. But that is, it can be alarming because nobody tells you about this. So this is someone who would benefit during that time from vaginal estrogen or a vaginal moisturizer. People going through chemotherapy, that is a huge one. They will have all of a lot of this, not all, but no one has all the symptoms of menopause. If you do, I'm very, very sorry. But there's like a mix or a match. You likely will get the vaginal dryness, the vaginal symptoms. It's called genitourinary syndrome of menopause. That's the fancy term. It's because it affects your genitals and it affects your urinary tract. We used to call it VVA or vulvovaginal atrophy, and that was to cover the whole area. But because it's well recognized, the effects on your urinary tract, your bladder, that's why we're calling it genitourinary syndrome of menopause, or GSM. That's like the code word. You got GSM. So GSM and urinary tract symptoms and vaginal vulvar symptoms, chemotherapy is a huge culprit. Some medications can also do it as well if you're on like estrogen blocking medications, if you're recovering from cancer, even if you had severe trauma, sometimes that will hurt your estrogen. Some people will lose their menstrual cycle when they're younger from trauma or from nutrient deficiencies or other reasons. I was diagnosed with primary ovarian failure when I was 20, and I didn't get my period for like 2 years at all. And then I'd get it like once and I wouldn't get it for like another 4 months. And I had almost all the symptoms of menopause. And here I am in my 20s, like I can't I just like was of drinking age and here I have all those menopausal symptoms. So that's one of the reasons why I'm so like passionate about educating women, because I know how scary it is when you don't know what the heck is happening. You're like, what is going on? And especially vaginal symptoms, it's not like you're just going to start like talking to like, oh, you see your neighbor getting the mail and they're like, oh, so are you having these vaginal symptoms too? I mean, we should be able to do that, but our culture and how we're brought up, it's kind of, we're just told as women, like, it's not ladylike to talk about our vagina. It's not ladylike to talk about sex. It's not ladylike even to talk about constipation and stuff like that. Like, we don't talk about those things. And then a lot of times you don't want to, you go to the doctor and it's hard to bring it up. And if you do bring it up, you're like, is he going to put me in the stirrups and am I going to have to do all that? So that fear alone, you'll just like, I'll just deal with it. I'll just wait till it gets a lot worse before I have to go through that situation. But the good news is how GSM is diagnosed is mostly with a conversation. So most of the time, unless it's time for your annual visit at your gyno, where they're going to put you in the stirrups anyway, most of the time they'll ask you a bunch of questions and they'll diagnose you that way. And they'll send you off with either a prescription for vaginal estrogen or another outcome that whatever your doctor wants to do, maybe a vaginal moisturizer. But a lot of times it doesn't require an exam. Now, if you use a vaginal moisturizer, if you use a vaginal estrogen, especially if you're doing the over-the-counter route and the symptoms don't get better, then you definitely do want to get in and see your gyno, because a lot of the symptoms could be other things. It could be lichen sclerosis. It could be, very rare vaginal cancer that is a thing, but it is very rare. But if symptoms are not getting better with the addition of the vaginal estrogen, the vaginal moisturizer, then you definitely do want to see what's going on. But most people will notice an improvement.
This has been great. Are there any questions that I didn't ask you that you want us to know?
Probably, I think I kind of touched on the cancer risk with hormones, or if you are at risk, if you've been told you should not use hormones, you can't use hormones. The low dose vaginal estrogen is in a completely different class. So oncologists across America, those are cancer doctors, they will agree that low dose vaginal estrogen does not have any increased risk. And you can just Google it and you'll see headline after headline after headline, from NIH to JAMA to North American Menopausal Society. And even though in the systemic hormone replacement world, we have debunked a lot of the cancer information, that is not as mainstream and as well regarded and everyone agreed upon as the low dose vaginal estrogen. So you can be very secure in knowing. Of course, check with your doctor. This is not medical advice, but it's well known that it poses no additional risk because there is no additional systemic increase in your estrogen. So I just wanted to kind of share that, because a lot of people still, it's kind of like if you've been told something a million times and then you're told the opposite thing, you still have in your back of your head the thing you've been told a million times, and that's the estrogen controversy. So I really like, there's a book called Estrogen Matters that just talks about estrogen in general. It's written by an oncologist. I really like that book. And then there is a doctor researcher, her name is Devaki Lindsay Berkson, and she wrote a paper called Estrogen Vindication. My goodness, that lady, bless her soul, because she took all these studies and she was actually there. You would be amazed at her age, because she was there at some of these things that you don't think that she's old enough to be at, but she looks amazing. She's a breast cancer survivor, and she takes all of the studies and all of this peer-reviewed research and she makes it easy to understand, because I can give you a list of studies, but you're going to go and even doctors will glaze over because it's very confusing. And so those two resources are my favorite, because they actually are made for like the regular person to read, the average woman to understand. So they're not glazed over, and you can bring those to your doctor if they don't agree with you.
I love that. Where can people find out more information about you?
Yeah, so you can go to my website is glownaturalwellness.com, but if you go to fixhormones.com, I have a free masterclass that talks all about hormone restoration, hormone replacement therapy, the myths, the misconceptions. And then you can find me on YouTube at Fix Hormones with Dr. Michelle, where I do a lot of free videos and education.
Awesome. Thank you so much, Dr. Michelle, for
You're
being
so
with us
welcome.
today. I love talking to you.
You
So
too. Thank you. Bless your soul for doing this event.
awesome. So everybody go check out Dr. Michelle's information.